Moderating and modifying activity are important for reducing the symptoms of arthritis. This may mean walking less, particularly if you walk for exercise, and walking for a long time significantly increases your discomfort. It may also mean avoiding stairs. Certainly, you should avoid athletic pursuits that cause pain, such as running and court sports involving directional changes, which can cause significant discomfort. Although you may have to modify your activities, it is important to keep moving the arthritic joint to maintain range of motion and strength. Your doctor may prescribe formal physical therapy instruction. You can also use an exercise bicycle with a high seat position and little resistance. A water exercise program is an excellent way to build strength and gain motion while avoiding weight bearing across the painful arthritic hip. Some people benefit from the use of heat, although it is often not effective because the heat cannot penetrate to the hip, which is a very deep-seated joint. Ice may also be tried, although many people find it uncomfortable. External support, such as a cane or crutch, in the hand opposite the arthritic hip can be helpful for walking, as it shifts the weight from the arthritic hip to the uninvolved hip. Along with these measures, oral medication can be of benefit. This medication usually begins with over-the-counter or non-prescription medications, including acetaminophen, ibuprofen, or naproxen. Once this medication is not effective in controlling discomfort, your doctor may prescribe non-steroidal medications. The use of nutraceuticals such as glucosamine and chondroitin sulfate may also be beneficial in moderate to severe osteoarthritis. Another treatment option is injection of cortisone into the arthritic hip joint to help decrease inflammation and therefore decrease pain. This measure, which can be employed several times a year, is temporary. How well it works and how long the effects last are unpredictable. Sometimes these injections require the use of a fluoroscope, which uses X-rays to create a moving image on a monitor so the doctor can make sure the needle is in the right place before injecting the medication. Arthritic disease of the hip is usually progressive. That is, it gets worse over time. Progression may not show on X-rays, but rather by increasing pain and incapacitation. Occasionally, X-rays may show a dramatic progression of arthritis, with substantial destruction of bone about the hip. In some instances, this can occur in a relatively short period of time. The measures just described are designed to allow an individual to live with an arthritic hip. If these measures become ineffective, you and your doctor may consider hip joint replacement.